The broadcast is now starting. All attendees are in listen-only mode.
Hi, everyone, and welcome to today's webinar, What You Need to Know About Sexual Health and Colorectal Cancer. I'm Sharon Worrell with the Fight Colorectal Cancer team, and before we get started, I just want to send a huge thank you to the rest of our team, especially Michael Sola, who's on the line today, helping with the tech, and also our communications team for all their help getting the webinar up and underway. And of course, we're thrilled to have Dr. Sharon Bober today from the Dana-Farber joining us for the webinar. After the webinar, you can view the recording online at fightcrc.org/webinars. During the webinar, you're able to ask questions throughout by typing your question into the panel on the right side of your screen. If you're on Twitter, feel free to follow along using the hashtag CRC webinar. And finally, after the webinar, you can expect an email with links to the material, the recording of the webinar, and a survey that if you fill it out, we will send you a bracelet. So here is just an example of what that control panel looks like. We use the GoToWebinar application for the webinar. Again, if you have a question, you just type it in, and we will see it and we will manage those at the end of the presentation. So Fight Colorectal Cancer has a comprehensive library of resources for patients, survivors, and others who have been affected by colorectal cancer. Your Guide in the Fight was updated last year and is a detailed resource discussing everything from diagnosis to treatment decision-making and more. We also have a podcast called Tabooty, where we discuss taboo topics. And we have a variety of mini magazines that really hone in on a few different topic areas, including clinical trials, side effect management, and more. So we do want to make a quick note that the information and services provided by Fight CRC are for general informational purposes only and are not intended to be a substitute for professional medical advice, diagnoses, or treatment. If you're ill or think you may be ill, please see a doctor immediately, and in an emergency, call 911 or go to the nearest emergency room. So we're very happy to have Dr. Bober with us. She is a senior psychologist at the Dana-Farber Cancer Institute, where she is the founding director of the Sexual Health Program, which is a multidisciplinary program that provides care for survivors of adults and pediatric cancer. In addition to research, she also teaches clinicians in various medical settings about how to address the topic of sexuality with patients and survivors. And with all that said, I'm excited to hand off the controls to you, Dr. Bober, and we'll get into the presentation.
Great, thank you very much. Happy to be here. Just want to make sure I can get to my slides. Okay, I think we're ready to start. So today we're really going to talk about a topic, speaking of taboo topics, that is one which affects so many cancer patients and survivors and families and partners. And it is a topic that unfortunately does not get a lot of attention. What we know is that for the majority of our patients and partners, often sexual health doesn't even make the list. And the reality is that it is in many ways the elephant in the room for many of us. This is something that is about quality of life, and it really needs to be addressed. So today I want to take a little bit of time to talk about, what is sexual health and why it's important, to really talk about the common challenges for patients and survivors, and probably most importantly to take time to think about the kind of clinical strategies and simple strategies that people should be aware of in order to address many of the issues. So really to start with, I think it's important to be able to kind of take a big step back and realize that when we're talking about sexual health and sexuality, we are not just talking about whether one is having intercourse or whether someone is having sex the way we think about it from the point of view of what's on a billboard or a movie screen, but really to recognize that sexuality is a much broader experience. It is certainly about our bodies, but it is also about how we think about ourselves, our identity, our emotions, our experience of self-image and body image, and that it's really a life-affirming experience across the lifespan. It is also, it is not only defined by whether one is partnered or not, by one whether is sexually active or not, in the sense that, we have an experience of ourselves as feeling masculine or feminine or sexy with or without a partner. And that from that point of view, it's in a context. Everybody has an experience around sexuality that's largely based on history and past experience, and is also informed by our hopes and expectations of the future, as well as what's going on currently. So thinking about sexual health, and when I talk about sexual health, I really try to keep in mind that it is really sort of from this sort of broad view that we're gonna go, and sort of on, sort of in that same vein, people often will say, well, what's normal? What should I expect? And I really think it's important to clarify that there's a very wide and varied range of normal sexual function. And really, most importantly, there are different meanings around sexuality and levels of importance to different people, especially at different points in our lives. But the most important point here is that if something is different, if something is distressing, if something is bothersome around sexual health in any way, then it means that it's an issue that really deserves to be addressed. So I would say that if there's something that is on your mind that you feel distressed or bothered by, then it means that it is worth addressing and that it's valuable and important in terms of quality of life. So thinking about the kinds of treatments that we bring to bear in terms of curing or managing cancer, we know that unfortunately every type of cancer treatment really has the potential to directly impact sexuality and sexual health and body image, and that is sort of across the spectrum of modalities that we use. And unfortunately, we also know that most colorectal cancer patients consider sexual function important in terms of functional outcomes, but they also say that they simply weren't prepared, that most patients expect that treatment is not going to disturb their sex life because nobody talks about it, and are unfortunately also subsequently distressed by many of these changes. And we certainly know that you can see from the quote at the bottom of the screen, somebody said to me in clinic not that long ago, it's sort of funny how doctors can go over all the possible outcomes, tell you everything that you need to worry about when you need to call the doctor, and yet nobody said a word about changes in sexual function. So, it is important to sort of appreciate that no one talks about it. And that seems to be the case whether you are in a big city, in a small city, in New England, or in Canada. For the most part, this is just not something that is routinely sort of integrated into review of systems in cancer care. And I often comment that I think it's a funny paradox, because certainly, at least in Western culture, we live in a culture that's really saturated with graphic images around sex, and every TV commercial or billboard to sell a car has a naked woman, but yet we don't have any real conversation about real sex, and certainly in most medical settings. So it sets up a funny gap in terms of consciousness around sexual health and sexual care. There are enormous amounts of unrealistic expectations that people carry, and misinformation about sexual health, and that's often a setup for some anxiety. And quite honestly, without going into details about the challenges and barriers, clinicians aren't often sure what to say if a patient endorses a problem. And I say this because, having done physician surveys and both in our group and groups across the country, we know that clinicians will acknowledge that this is an important topic, but also will acknowledge that they have no training in how to talk about this and don't really feel comfortable. So often that's the reason why clinicians don't sort of drive that conversation. And that's part of the work that I think has to be done, is to also give clinicians more training as well as patients. So, sort of on that note, lots of barriers for providers. As I just said, often people feel embarrassed or don't want to embarrass you, and aren't sure sort of whose responsibility it is. But also for patients, we fear being judged. Nobody wants to come across as looking odd or strange that you're bringing up a taboo topic. It can certainly be challenging in terms of finding the right language. Often patients will say that we don't want to embarrass our doctors, and quite honestly, we aren't asked. So I think it's important to sort of recognize that there are barriers and challenges on both sides of the communication. But again, and the bottom line is this: what we know is that patients with advanced disease, patients with disease across the continuum of care, really think it's important to have this part of their experience addressed, and that really the closeness and the sort of shared intimacy that can be deepened by addressing this is important for quality of life. And often partners, similarly, are left with patients or by themselves to cope alone without a lot of support. So these are the problems that I will sort of briefly touch on all of them in a way, but really to sort of acknowledge that there are different ways we can sort of categorize common problems after colorectal cancer treatment. Certainly we see changes in desire and motivation, so whether that's reduced desire, loss of libido, reduced motivation, and also decrease in, again, body image and sense of kind of self-esteem, confidence, sexual self-esteem. And then we also see a range of changes in sexual response, both for men and women. Certainly around arousal, erectile function for guys, for women, that may be change in sort of genital arousal, certainly reduced lubrication, vaginal dryness, issues with orgasm for men and for women, and often people are dealing with discomfort or pain. So those are the sort of most common problems that we see, and that we really need to be able to address directly. I will also say that in addition to the kind of physical sequelae of cancer treatment, we also know that disruption in sexual function kind of has what I would call collateral damage, right? That there are, it is related to changes in mood. People feel more anxious. People feel distressed about it. We again have a sense of loss that can impact our sense of self-esteem and confidence and body image. There is relationship distress that happens when people have changes in roles, changes in sexual function, and it may be hard to talk about, or a couple may find that maybe they are not physically sort of connected in the same way, and that can often then translate to a kind of an emotional sense of space or disconnection that doesn't feel the way that it used to. And I think it's also challenging around dating for people who are not partnered, for folks that are thinking about how do I start to date again, or how would I potentially find a partner and become sexually active after I've gone through this, and that's challenging. So, I would say that, in terms of why it's important, I know I mentioned quality of life, and when we look at, what that means more specifically, I would argue that when sexual function is something that is not distressed, when people are not, it is intact and people find that it's a satisfying aspect of experience, we know that it can reduce stress and tension. We know that it can actually decrease feelings of depression or anxiety that are that come up in other parts of our lives, and that, I think it helps maintain a sense of identity, and it can promote good sleep and relaxation and stress management, and can even relieve pain. So there are lots of good reasons in terms of quality of life why it's important to address this. So let's get into the details of what we're talking about and what we can do about it. In terms of this is a sort of a schematic of what we call the BioPsychoSocial model of sexual function. And really what this means is that when we look at sexual problems or how sexual function may be disrupted by cancer treatment, it's really important to take what I think of as an integrative perspective, recognizing that often there are changes in the body, clearly, but there are also changes that are psychological. There are maybe changes that are sort of interpersonal or relational in some way, and that all of this happens in the context of, again, a kind of a social cultural lens. So, people have religious beliefs, cultural values, social norms that were the case before cancer, and that may well come into play after we go through treatment. And it's really important to sort of keep that framework in mind when we're addressing the issues, so that when somebody has something that is bothersome or distressing, we really need to think very clearly about what part of that integration is disrupted, and what we can do to make things better. So, and I will go through this with you, but thinking about sexual rehabilitation in the context of general health and overall well-being, specifically thinking about the mental psychological piece of this, whether it's emotional, whether it's more cognitive, whether it's sort of at the level of motivation, and thinking about the social and cultural pieces as well, are really important. And so I would sort of invite everybody to think, when they're sort of moving through this, not just about the problem, but really what the underlying ingredients are in that recipe, and where you might need to do some work to make things, to improve things. So often, for example, we see that there's a pattern where there may be sort of a change in body integrity. Maybe there's a alteration. Maybe somebody has an ostomy. There's a change in sensation or function. And it's interesting. What often can happen is that patients can become very vigilant, worrisome, anxious about that, and then move into a place where they want to sort of avoid, that area of their experience around sort of sexuality totally. And that is often a common pattern that we see. And the perspective from sexual rehabilitation is really to say that alternatively, we can really learn to cope with these changes rather than to be in a place where we either have to distract ourselves or avoid sexual health because the changes are concerning. So I think it is important to start with the body, because I think that, thinking about sexual health from the point of view of overall health and well-being, we need, it's really important, especially if patients are having any experience around pain, vaginal dryness, to really address whatever those mechanics are. I think it's actually critical to start there, because, especially if somebody is having physical discomfort, it would be very strange to also think about how to improve libido, for example, if sex hurts. So I think it's really important to start with the body, and to recognize that, we're thinking about sexual health in the same vein as we are about sleep and exercise and other kinds of kind of overall sort of general sort of health issues. And this is also the time where you sort of need to sort of say, well, what are the relevant medical factors that you might also need to address? So if somebody's having a neuropathy, if somebody's having changes in hormones, if somebody's has changes in just anatomy, mobility, we really might need to troubleshoot about how to functionally address some of those issues. Very specifically, I also want to sort of recognize after colorectal cancer that sometimes the body changes are obvious, whether that's scars or ostomies or incontinence. Sometimes they are less obvious. Sometimes people are dealing with loss of sensation or neuropathy, and that whether it's obvious or not obvious, all of those changes really do have an impact on how we feel about ourselves, whether we feel attractive, whether we feel sexy, has an experience of sort of self-esteem. And I acknowledge that the changes can be hard to talk about. So, just to say that, again, starting with the body is important from, I think, a functional point of view, and also from the point of view of how do we then start to be able to feel comfortable in our bodies? How do we start to feel a greater sense of body integrity again, and to reclaim a sense of confidence in terms of self-esteem? So I would say, one of the ways to think about that in terms of how we get started, and I do think it's very sort of much around sort of behavioral activation. We have to start by doing something. I think it's really important to get active in whatever way one can. So whether that's just walking, whether that's yoga, whether that's dancing, whether that's exercise and weight training, basically focusing on strength and endurance, however it is feasible for you is really important. I think it's important in terms of being able to appreciate how your body has gotten you where you are today. Sometimes we focus a lot on how we can be disappointed in our bodies, but it's really important to make a mental note of saying, on the other hand, I'm here. My body has also gotten me through to today, and I'm grateful to be here now. And what do I sort of focus on in terms of the strength that I have and the capacity for endurance that I have, and to sort of acknowledge that things may be different, there may be changes, there may be losses that I have to acknowledge and accept, but that I can also choose to pay attention to something that I like and I appreciate in my body, and I'm really going to commit to an open mind, that it's not only being, say, disappointed, but there are also aspects of my physical experience which I can be appreciative of. There may be parts of my body that I haven't even paid much attention to, but when I take the time and I stand back and I think, gosh, I like my hands, or I'm grateful that I can still kiss, or I'm happy that, it feels good when I have my back rubbed. So, really sort of thinking about how you get started, focusing on what feels strong, what you feel comfortable with, and being active in terms of feeling like you've been able to get to today and having that sort of cultivating that sense of appreciation for the body. Despite or in the context of all the things that are maybe different, is an important counterbalance as we're moving to a place of sort of having a sense of acceptance for where we are currently. Also on that note, it's important to manage pain and fatigue. That's a really big one when it comes to sexual health. And certainly, if you're dealing with fatigue and you're feeling tired, it's understandable why, you don't have a lot of energy, including sexual energy. But this is also really where I would say it's important to sort of set realistic goals, to think about troubleshooting in terms of finding times of day where you maybe have more energy, where you can sort of emphasize the importance of non-penetrative sexual activity, but we're starting to shift a focus to where you can sort of seek a sense of pleasure and sensual experience in the body rather than sex as a starting point. If it is about sexual activity, thinking about what you can do in terms of pre-treating with pain meds, etc., but sort of acknowledging that really do need to manage the fatigue and pain piece as part of also addressing sexual function. Also on that note, I will, or say on the next note, sort of moving, sort of thinking just about the body, it's also really important to sort of recognize that there's a sort of a mental piece that often is sort of very closely connected when we're feeling distressed. And so this is to say that often we have thoughts that are about avoiding or distracting ourselves from sexual experience because it serves to protect us in some way from feeling anxiety. And so I often will offer, patients a kind of an opportunity to sort of tune into one aspect of their physical experience and really not do anything. Just notice where you are, what comes to mind, what happens in that moment. Sometimes patients or survivors will talk about when they sort of pause and don't do anything. It's almost like they'll notice a tape loop that gets turned on, and whether that's sort of thoughts about, gosh, I really just don't like how I look, or I'm never going to be attractive again, or I wonder if my partner is still attracted to me, I don't know. But, being able to sort of notice that those are thoughts that we can actually address and talk back to. You could practice talking back to those thoughts as if you were challenging a friend, for example. If a friend you were sitting with in a support group said that, you probably would say, well, wait a minute, that's not totally true, or I'm not so sure, or actually, how do you know that? You don't have any evidence for that. We would challenge those thoughts, and sort of also recognizing that the sort of constant tape loop of thoughts that go with sort of the distraction and avoidance around sexual health, again, are just thoughts, and this is very much taking a note out of the kind of the mindfulness perspective where, intensity of thought doesn't necessarily mean that they're true or more true, and that thoughts really come and go, and that our job, most importantly, is to notice them and not rush to judgment, and often recognize that we can challenge some of those thoughts as well. So coming back to some of the basics in terms of the nuts and bolts for what men and women have to know about the body, I do want to talk about women's experience around any kind of disrupted ovarian function. That may be from chemotherapy, it may be from surgery, but where a woman is in a situation where she has a significant depletion of estrogen, this could also be from radiation, I should say. But when a woman has disrupted ovarian function and essentially a depletion of estrogen, we know that this has significant impact on the vaginal tissue, on the genital tissue. What happens is that there's significant loss of, there may been loss of vaginal length, but mostly blood supply, lubrication, elasticity, are big ones, and that is directly related to potential pain and inflammation. We also know that when women lose or go through menopause, treatment-induced menopause in particular, because often that can be more dramatic, about half of their testosterone, which is made by the ovaries. So this is a slide that we often show patients to say that, you know, what every woman really needs to know in terms of managing vaginal health after cancer treatment is that you need moisture and you need stretch and you need blood flow to that vaginal tissue in order to keep the genital tissue healthy. And that the good news is that we are really able to replace moisture and stretch and blood flow to optimize vaginal health after cancer treatment. Unfortunately, this is not something that everybody hears about. And it's often the case that people have questions about this and often just don't even know that there's help available. It's super common that women have vaginal dryness. Often if people hear anything, people hear about using a lubricant, and I'm happy to talk about lubricants, but most importantly, there's a set of products called vaginal moisturizers, which are different than vaginal lubricants. Moisturizers are products that essentially hold water in the tissue and last over time, more comparable to a moisturizer that one might put on their face before they go to bed at night or on their hands in the cold weather. And that is different than a topical lubricant, which is really just meant to keep the surface skin slick during sexual activity. So it's really important for any woman who's dealing with vaginal dryness to learn about vaginal moisturizers, and typically those are used on a regular basis as sort of part of regular self-care, typically 3 to 5 times a week as needed. Some women find they're more comfortable using them more times a week. Some women find that 2 to 3 times a week is adequate, and that we have, several studies now have really shown that vaginal moisturizers are very effective at reducing vaginal dryness. I would also, again, suggest that this is not about sexual activity. That vaginal health is certainly related to sexual health, but it's not only about sexual health. It's important to be able to have a GYN exam comfortably. It's important for women not to have symptoms, burning, itching, etc., if they're uncomfortable, again, with or without sexual activity. So certainly that's about moisturizers. Helpful to know about lubricants as well. Often for women who are in menopause and dealing with vaginal dryness, it's important to use a lubricant in addition to a moisturizer during sexual activity. We recommend using something water-based or silicone-based. Probably stay away from a glycerin-based product because glycerin can act like a sugar and promote a yeast infection if you're vulnerable to that. And generally, we typically, think about going with something that's sort of more natural and perfume-free, because often that vaginal tissue can be more sensitive post-menopause. Another option for helping that genital tissue be more supple, softer, is using some pure coconut oil, certainly around the perineum and the introitus, the opening of the vagina. We'll also just sort of come back to it for a second to the vaginal moisturizer idea, which is that when you use a moisturizer, it's really important, in addition to just inserting that moisturizer, to making sure that you moisturize the vulva. Put a little bit on your fingertips and rub that around the tissue, the external tissue, is very important, because similarly that vulvar tissue does not get loses moisture as well. Also, we'll just mention that for women who are having a lot of dryness and discomfort, over and beyond what you can get in terms of a non-hormonal vaginal moisturizer, another possibility is to consider using vaginal estrogen. This is not systemically absorbed. This is sort of several different mechanisms for delivery, whether that's with a ring or a tablet that dissolves. And you can certainly talk with your providers about that if you're using a moisturizer and finding that you're still dealing with some dryness, and that's something which is an option. But also want to sort of put a plug in for the piece around stretch and blood flow, because this is something that we don't talk about a lot. Often if women hear anything, they hear, oh, use a lubricant. But learning about the pelvic floor is a really important part of sexual rehabilitation for women. We know that the pelvic floor muscles play a very important role around arousal and orgasm. And often when women go through cancer treatment, especially whether they've had any kind of pelvic involvement, whether it's with surgery or radiation, chemotherapy, those pelvic floor muscles get very tight. Women can have what we call sort of a hypertonic pelvic floor, and that can really directly contribute to pain and discomfort with any sexual activity. And so, learning about the pelvic floor in terms of how to both relax those muscles as well to tone those muscles. Interestingly, often women hear about, Kegel exercises if someone's had a baby, and that's really all about how to make the pelvic floor muscles stronger or tighter. But often the key for sexual health rehabilitation is really learning how to flexibly be able to have the muscles be toned when they need to be toned, but have them also be relaxed when they need to be relaxed. And that's really an important piece, because if anyone has had sexual activity that is painful, there can often be a kind of a secondary automatic clenching of those pelvic floor muscles in anticipation of discomfort or pain. And so it's really important to be able to sort of flexibly strengthen and relax the pelvic floor. And there are a number of different modalities to do that. Certainly, vaginal dilators are something that are commonly used in order to be able to just sort of gently, systematically stretch the pelvic, the genital tissue. We often work very closely with some wonderful pelvic floor physical therapists. I would say that pelvic floor physical therapy is probably one of the most important modalities for helping women around increasing elasticity, again, that often people don't know about. And that is certainly something that you can not just talk to your team about, but you can certainly get a referral. Most folks know how to get to the PT folks at their hospital, and then you can ask them, is there somebody who specializes in working with women in pelvic floor work? The people who do this work are typically excellent and are very specialized training around pelvic floor work. So I'll also just lastly say for women, we talk about this very easily for men, not so much for women, but getting blood flow to that tissue is also really healthy, important for female sexual health. Anything we can do to kind of get nerves firing and clitoral stimulation to get, oxygenated blood flow to that tissue is important. Certainly there's, a small clitoral vacuum pump sort of approved by FDA in order to sort of increase genital blood flow called the Eros, but you really, and that's been shown in a small RCT to actually have a very positive effect on desire and satisfaction. But I would just say that you don't need to get a prescription and a very expensive, vacuum pump. You can just get a vibrator, and there are lots of them out there. And the point here is that whether it's a vibrator, whether it's manual manipulation, however, with a partner by yourself, the point here is that anything you can do to get nerves firing and blood flowing, regardless of whether you have the experience of orgasm, more importantly, what you want is to be able to just have pleasurable sensation. You can also know that at the biological level, that means that you really are getting good blood flow to that peripheral tissue, which is really healthy for restoring genital health and helpful for sexual health. So really it's that combination approach of thinking about blood flow and elasticity and moisture, which are really together important for restoring vaginal health. I want to talk a little bit about some of the common issues that we see for men in terms of changes in erectile function. Certainly, it is common that guys struggle with either getting or maintaining a firm erection. Also, reaching orgasm is problematic. Sometimes men are concerned about having climax without any ejaculate, or worry about, if urine is going to leak out instead of semen. And sometimes we just know that, the issues around that climax is not as intense as it used to be. And it is possible after colorectal cancer treatment, sometimes men have experience of pain. Testicular pain as well. So, if in the same way that we think about sexual rehabilitation for women, it's really important to think about treating erectile dysfunction for men, also from a rehab perspective. And this similarly, as we see sort of with women, we think a lot about what that means to restore blood flow to penile tissue on a regular basis, to restore stretch and tissue elasticity, and really promote nerve stimulation. Again, very important. So, not only thinking about, for example, use of the PDE5 inhibitors like Viagra or Cialis on demand, but also thinking potentially about low dose use on a more kind of regular basis as part of rehabilitation is a modality that's being used more commonly now. Thinking about what it means to do a fair amount of self-touch or masturbation or massage, just to promote nerve stimulation. Doing pelvic floor work is really important for guys as well, and can be really helpful around all the issues around incontinence, as well as increasing intensity of orgasm or climax. And there actually are new modalities that are being explored, like vibration therapy, in a more significant way. So I'd say the jury's out on some of that in terms of sort of impact, but is being closely studied now. So I also think for men, it's really important to or for men and for women, I will just sort of say that, we live in a crazy culture around sex. I think it's really important to have realistic expectations. It's not only just about whether you can get an erection or not, although that's the message that we sort of constantly get, which is like, can you have a hard erection for a long time? But that, again, that is not, that's not necessarily the goal. And it's certainly also not realistic to always think about only measuring sexual satisfaction from the point of view of erectile function, especially over time. So, I think that, just sort of recognizing that, men can have sexual activity with an erection that is semi-erect. Men can have orgasm without an erection, is something that many men realize that after the fact, and they think, gosh, I had no idea that was even possible. So again, trying to kind of take the broader view, but also, again, very much appreciating that, guys often are used to being able to have an erection at some point and would like to be able to have one again. And it's okay to recognize that, sometimes the PDE5 meds don't work by themselves. They don't necessarily have any impact on desire, but there are other options. So, for example, we do have the capacity for something called penile injection therapy. Very, very small needle, minimal discomfort. Guys do need to learn sort of the techniques of how you use that. But when you can inject a small amount of a sort of compounded medication directly into the side of the penis, where you can kind of relax the smooth muscle cells and allow blood flow directly into the penile tissue, can be much more effective than a pill. So, that is the case, and often we will work closely with the sexual medicine folks on the male side in order to use that modality. But to say that there are a number of mechanical options. Similarly, there are options that are non-medical, like a vacuum pump. So that is the picture of a vacuum pump on the slide, where we can use essentially a canister, create a vacuum seal, and sort of from a kind of a mechanical point of view, kind of help guys get an erection mechanically. And so there are a number of options out there. I think there's a picture of what's called a Viborect. This is also a new, again, treatment, and from that sort of vibration therapy idea that you can, again, thinking about what you can do to get nerves firing and vibration happening in order to get blood flow to that tissue. So number of different kind of mechanical options. If for whatever reason you have tried one of the pills and it doesn't work, I think the point here is that you don't need to sort of give up, but to know that there are a number of other mechanical options. So I do want to speak briefly about some of the specific challenges that we know around colorectal cancer. Certainly, the ostomy challenge is one which, people sort of widely talk about in some ways, and in other ways don't talk about at all, depending on the context. What's interesting is I think there are a number of sort of younger generation folks that are now sort of going more public around, pictures at the beach and bikinis with their ostomy pouch. And, it's really, in that sense, I think a little different than it used to be. And I think becoming much more common that we can sort of talk about it without this feeling taboo. But, the question is, just again, from a kind of a functional point of view, what are some of the kinds of things we need to think about? And, when we're thinking about getting close to someone and being intimate, just all the issues around hygiene are obvious, right? And sometimes we need to just think sort of how to troubleshoot around some of that. So, whether that's, taking an over-the-counter med to reduce gas like Beano or avoiding a gassy food beforehand. There are gas filters, like specially formulated deodorizers out there. And just also sort of having a regimen that works, remembering to empty the pouch before sexual activity or making sure the pouch is secure. It's not uncommon that people feel just uncomfortable or worried, or am I gonna, what's gonna happen if it leaks? And, I think it's really important to be able to practice, to be able to have different kind of strategies for what to do and talk to partners about that. I'm also a big fan of sort of recognizing that sometimes you don't have to come to a place where you're totally comfortable in order to still feel like you can be close or that you can still give and receive pleasure. So, get a pouch, get something that covers the ostomy. I always say use camouflage, keep a shirt on, or get crotchless panties and, be able to keep a panty over it. I think the point here is that you don't need to feel totally comfortable in order to potentially explore how to have a pleasurable sensual experience. They are not mutually exclusive. So, being able to figure out, can I get away with a smaller pouch during sex? Can I irrigate beforehand? Can I try a different position? Is there something that I can do where it's not going to feel like it's in the way? I think the key here is to be able to say, yeah, these are challenges, and to be honest about that, but also to acknowledge that there's actually a fair amount of I think group wisdom around how to troubleshoot some of these things, and to be able to sort of be practical about it. So the concept here is that, yes, we have to accept some of the changes, but we also don't have to be defined by them. We do not have to have these challenges sort of define who we are, so that there's not a way to sort of work around them. And I think sometimes it's just, being able to sort of have an attitude of perseverance and creativity and humor can be really helpful around sort of recovery of sexual health. So I do want to talk briefly about another common issue for men and for women, which is low desire. And certainly low desire can very well be impacted by all of the kinds of things that we've talked about so far. And I think here the starting point is to really shift our focus to pleasure and sensuality, and to really reduce the pressure that comes from being focused on trying to be goal-oriented or trying to achieve a specific type of being sexually active. Whereas if we can sort of broaden the repertoire, really sort of allow for wider modes of expression, then we can start to jumpstart what might be a feeling of desire. We can start to cultivate an experience of curiosity, of interest, of what feels good. Really important, though, to reduce the pressure of having high expectation for a very specific goal, and to really be able to just shift our focus to saying, I need to figure out what feels good. I need to figure out how I can feel good, how I can give pleasure, because sometimes it is very erotic to be able to pleasure someone else. And that can also be an important part of jumpstarting our own experience of desire. So really thinking about that in terms of cultivating desire. And I think probably the first thing to sort of appreciate, especially as one gets either older, through midlife, going through cancer, is that desire does not need to be spontaneous. Desire often shifts from being spontaneous to being something that's more responsive or reactive, where we really have to kind of cultivate it, not like a light switch anymore. And that doesn't mean that there's something wrong. It just means that one has gone through an experience that's either traumatic or challenging or through midlife, and that, desire is something that we have to kind of cultivate rather than just expect to just be there. Similarly, we also, generally can't wait for desire to just spontaneously come back, because typically what happens is that the longer we wait, the more it actually becomes a bit more muted. It is not something that is just spontaneous. So what does that mean to cultivate it? It means we have to bring our attention to it. It means we have to have intention. We have to say, this is important. I'm going to really make time for, being with my partner, or masturbating, or trying out a vibrator, or talking about this with somebody that I'm dating, just to sort of say, like, I'm going to choose, I'm going to have with intention. So to say, this is important to me. I want to be curious about it. I want to have a commitment to do something about it. And I don't have an expectation that it has to be a certain way, but that I really want to sort of do some exploring. And all of those aspects are important in terms of how you jumpstart an experience by probably having an experience that feels nice, that feels good, that feels sensual, that feels close, that doesn't make you feel panicky or worried, but that feels comforting or sensual or erotic. So often you have to have an experience which allows you to then get in the mood. And so you're really starting from cultivation rather than having an expectation of starting out, of just being in the mood. And so that's what we just talked about. Also just want to say that sort of on this slide, again, I want to sort of go back to that idea that, when there are changes in the body, we don't have to be overly focused on having to love all of our body or feeling perfectly comfortable in our body in order to start either giving or receiving, having some kind of physical pleasure. And that it's very important not to feel held back by some of those challenges. I do want to talk a little bit about relationships, whether that's being in a relationship or potentially dating, but just to say that, so much of this is often in a relational context, understanding kind of how to talk about some of this is important. I also appreciate that, sometimes couples never had to talk about this and didn't have a lot of experience talking about this beforehand, so it kind of can be more stressful after. But the point of the matter is that being able to increase communication is really important, and that's, I think, the case not just around cancer, but just around aging in general, that sometimes bodies change. Things are not the same 10 or 20 or 30 years into a marriage after, dating, or, when there's change in roles, or, novelty is not what it used to be. And sort of being able to sort of talk about how to commit to be together, how to say, listen, I really miss this part of our relationship, or I'm interested in being able to spend some time where, we're in bed, but not in front of us, we don't have a screen on, or that we are not both just super tired, or a time that actually I have more energy. And what can we do to find a time where we commit to that's the intimacy piece, the communication, the feeling close part, that isn't only just about trying to have sex, but that's also just about trying to kind of have a new chapter, I would say, in terms of one's sexual experience. And I do think that using a new chapter as a metaphor is really also helpful around sexual health after cancer, because sometimes things are different. There are things that may not be the same again. And rather than sort of having an expectation or hope that it could be the way it was, it can be really helpful for partners, or also certainly in the case when you're dating, to really think of it as a new chapter and a new opportunity to kind of forge a new dynamic around all of this. Maybe it's something that we talk about. Maybe now foreplay is much more important than it used to be. Maybe now it's important for somebody to figure out, parts of their physical experience that they'd never paid much attention to before. In that sense, it really becomes an important opportunity to expand the repertoire. So, all of these, things on the list are part of how to be sexual, right? And they're not necessarily about intercourse. So, whether that's sharing a massage, or getting a back scratch, or, spending a lot more time kissing. And often I laugh with couples because they'll say, well, who makes out anymore? We've been married for 30 years. And, that's a really lovely part of dating that often people don't do very much after a while. And, just sort of recognizing that, going back to dating, going back to the kinds of things that are romantic, are exciting, are interesting before there's a lot of focus or exclusive focus only on intercourse. It's a really important way to also, again, jumpstart some of the feeling of closeness. And, you know, I say this recognizing that sometimes when I work with couples, somebody will say, well, I'm not ready to sort of be sexually active, and if I do one of these things, what if it gives the other partner the impression that I want to do more and I'm not ready? And I say, well, this is exactly where you have to be able to communicate, right? So being able to talk about saying, listen, I'm not ready to go from 0 to 60, you know, I might not be ready to resume, you know, having intercourse or sexual activity, but I really want to explore how to put a toe in the water and get used to my body again, or start to feel comfortable again. Would that be okay? Can we do that? And being able to sort of talk about that is a very helpful kind of entry into broadening the repertoire. So I think the sort of coming toward the end here, I think the point I also really want to convey is that moving not just from spontaneity to intention, it also means that you have to have a plan, and that it's not some, you know, sexual recovery is typically not something that just happens by itself. It is something that I sort of think of it more like exercise. You really have to do it in order to feel better, and that, you know, you can't just exercise once and you can't just wait. And lots of times people aren't in the mood to exercise, but once you go for a walk or you get to the gym, you do feel awfully much better after. So I think that's a comparable metaphor. And so I think, you know, figuring out how to begin slowly, but nevertheless how to begin by making a plan, figuring out, you know, by taking the pleasure off, what are some initial steps one can take, and how does all of this fit into one's lifestyle? You know, just does it mean you want to sort of also start to exercise more or do some stress management or some mindfulness, you know, recognizing that all of how we feel is connected up, you know, to sexual function, right? So again, if you're feeling stressed, if you're feeling distressed or anxious or worried, you know, that's also going to have an impact on libido. So, you know, going from spontaneity to a plan with intention is really helpful. And, you know, to say that there are resources out there. So certainly here at the Dana-Farber, we have a sexual health program. We have more and more information all the time online, and I know that colleagues do as well. A lot of information from Sloan Kettering online. The University of Chicago Women's Lab has a lot online, and I think there's more all the time, certainly through American Cancer Society and NCI as well. So, so I would really encourage folks to feel free to, you know, explore the growing resources that we now have, and really happy to be with you here today. So thank you.
Thank you so much, Dr. Bober. What a wonderful presentation. We really appreciate the depth, and, you know, we hear all the time at Fight CRC that this is a topic area that is not often addressed by doctors. So we really appreciate you taking the time to present today. We do have a couple questions that came in, a lot of thank you notes coming into the question box as well from the folks that are listening live. So since we just have a couple minutes, I will go ahead and moderate just a couple of questions here. The first question, how much is known about long-term survivorship and sexual health? So we're talking about 15 plus years.
So I think that we are learning more all the time as we now have a growing number of, you know, millions of cancer survivors who are living long term. What we do know is that some of the sexual problems that people have last for decades. Unfortunately, you know, these problems, many of them don't, you know, as I mentioned, don't spontaneously get better. So for people who are dealing with, whether it's vaginal atrophy, you know, whether it's low libido, you know, it is actually not surprising that people often live very long time with some of these problems, because mainly the problems themselves are typically not kind of self-resolving. So that is something that we see more of as we are following survivors longer term.
Thank you. Another question. So this is around APR. So the abdominal perineal resection surgery. This person had an APR and now an anterior prolapse. In your opinion, do you think a bladder lift repair would be justified to reduce the pain during sexual intercourse?
Yeah, so that is a medical question that I'm not really comfortable addressing because I don't really know the answer. I think that, but what I would say is I think it's important to get more than one opinion on that. And it's probably really important to be clear on what is causing the pain, so you can have a good sense of why that surgery may or may not help. But I think probably important to get it probably get at least two opinions on that.
Right. Okay, so I think we have time for two more. Thank you. So a person who is 2 years post-chemo and radiation has experienced severe vaginal stenosis. Would it have been, would be maintaining sexual activity prevented this from happening?
So I don't think it necessarily would have prevented it from happening, but what does often happen is that, I don't know if this person is still using the vaginal dilators, which are typically given for folks, I assume this is a woman who's asking the question. I think the key here is that it is very possible to regain elasticity in vaginal health or sort of genital stretch, but that probably at this point it may well be very helpful to have to do sort of an active treatment of some pelvic floor physical therapy. The issue is that after radiation therapy, there is the stenosis that comes from radiation often happens over time. It is not something you see right away. It's sort of like a competing process. So, it is important to maintain stretch to that tissue. So whether that would be having sexual intercourse, whether that's using a vaginal dilator, whether that's using a dildo, something that allows the tissue to stay open is important. But it's not clear that that alone would have made all the difference. I think it's usually a combination treatment, but I think most importantly, even, a couple of years later, it is very possible to restore health to that tissue, but probably would need to, to sort of be active in terms of a strategy, a plan, and most likely thinking about pelvic floor physical therapy is what comes to mind first and foremost.
Thank you. And I think our last question here, since we're running low on time, I fear that my erectile dysfunction is psychological. Any tips for that, or how to manage that?
Yeah, I don't really, so I appreciate that. Yes, so I would just say the good news is that there's a lot of things one can do. It's, probably first and foremost doing some reading online and then thinking about, finding a therapist that doesn't necessarily have to be a sex therapist, although it could be, but somebody who can help figure out, what are the, not just what are the problems, but what are the sort of psychological strategies that one can use to either reduce anxiety, sort of reframe cognition, or maybe sort of help in terms of the relational aspect of that. But that in that case, in that sense, sort of counseling or therapy with somebody who is knowledgeable can be very, very helpful.
Thank you. All right, well, we're up on our time, the hour. So Dr. Bober, I can't thank you enough for a wonderful webinar. And if, we look forward to covering this topic again in the future. I know it's a hot topic and it's one that needs a lot more coverage. So thank you again for your time, and thank you everyone for listening in.
Okay, thank you.
Thank you. Bye-bye.